Hi everybody, Dr. Stu here for this issue of Dr. Stu's 5-Minute Health Message. The topic we're going to be talking about today is ear infections. Quite often I get questions in the office from patients asking about how does chiropractic help with ear infections? And this just came up recently with a family member who was asking the same questions. So I figured it was a perfect time to do a video for this one. Now the chiropractic model behind chiropractic for ear infections is basically a mechanical irritation. Now there's 26 bones in your spine. The 7 in the neck are called the cervical vertebra. Now these bones can and do come out of alignment. Now the top bone of the neck is called the atlas. Now this is the most freely movable bone in the spine. And this bone, this atlas, can come out of alignment and deviate. And if it slides over, it can actually literally pinch off the eustachian tube, not allowing for proper drainage. Now this becomes a problem because if the ear is not draining properly, the body temperature is on average 98.6 degrees, and when if it's not draining properly, it's dark, it's moist, and a perfect breeding ground for bacteria or any kind of microbe. So it's literally a little petri dish for microbial growth. Now you add in addition to this mechanical irritation, quite often some children are sensitive to things like dairy. And sometimes wheat and gluten can cause allergic responses, which doesn't allow more mucus and things in the body, which won't allow for proper drainage. Again, so there's not proper drainage, there's mucus forming in the body, and it's a perfect breeding ground for bacteria. So as a chiropractor, what we do is we adjust the spine. In addition to giving nutritional recommendations, we give mechanical adjustment, a very gentle procedure called a chiropractic adjustment, taking pressure off the vertebra, which now will allow the pressure off the eustachian tube to allow proper drainage. So we can either use our hands or use an instrument which lightly taps the vertebra and takes pressure off that vertebra, which allows proper drainage of the eustachian tube. Now, how this may contrast to traditional treatments of children with ear infections is more times not, parents will take their child to their medical doctor. If they have an ear infection, quite often they'll get a prescription for an antibiotic. Now, sometimes that may be necessary. However, first you need to discriminate between a bacterial infection and a viral infection. If it's a viral infection, then an antibiotic wouldn't be effective. We also have to be concerned about the use of antibiotics because over the years we've had indiscriminate use of an overuse of antibiotics, which also understand will kill the natural good bacteria which we have in our body. And for young children, you don't want to affect their intestinal flora because it can lead to other health issues that we would like to avoid. Now, the other form of treatment that quite often common is the placement, is more of a surgical procedure or the placement of tubes in the ear. Now, the idea of the tube is to keep the ear canal open, preventing that pinching, and allow proper drainage of the fluids. But the problem with the ear, with the tubes could arise where, number one, they could get rejected easily. Two is, at times, they've been shown to form scar tissue within the ear canal. Now, that becomes a problem down the line, or even, because that can form scar tissue, that scar tissue can affect hearing later on. And there have been studies that show that hearing loss later in life could be affected by ear tubes as children. Also, that scar tissue can affect balance and coordination because these nerves up here, called the cranial nerves, also affect balance, coordination, and neurological function. So you want to try to avoid that as much as possible. So just recently, I had a patient come into the office. She's been bringing her children in, and she just shared good news that this is the first year that her children have not had any ear infections. And the only thing different that she knows is that she's been getting them under chiropractic care. So again, anecdotal story, but it has been shown to be very effective. And basically, chiropractic, our approach is more holistic. Our philosophy is try chiropractic first, drugs second, surgery last. You can always have a surgical procedure, take drugs. However, why not try something less invasive, more conservative first, see how it improves and it can be effective, and then you can always go to the other options. So I hope you found this informative. If there's anything we can do for you at the office, please do not hesitate to call, email us. We're always here for you. Thank you very much.